So I may not follow the exact order that it is in the notes. I'm going to follow it based on what position the patient's in, so I don't have to flip around as much. So we're going to start with supine. Yeah, you can. All right, so now let's do a couple of the ligament tests, right? What is the anterior cruciate restrict? What kind of anterior translation of the tibia in relation to the femur? So I'm pulling forward like this. Like I mentioned before, is that you can put your thumbs so that they go across the eyes of the knee. So my thumb, bottom of my thumb's on the tibia, the top's on the femur. You may not be able to do that if your hands are small and the first patient's knee is big. And then you don't want to sit on their foot, but you just go here, sit against the side of it to stabilize it like that. Okay? So anterior cruciate, what am I going to do for posterior? Push back. Okay? So that's in the sagittal plane. So single plane. So now we're going to talk about combined planes. If I turn internally, which side of the knee has moved more forward? Lateral side. So if I pull forward like this, what kind of instability am I talking about? Anterolateral. Okay? If I push back, posteromedial. So just think of it in terms of, let's cross it this way and this way. So if I do external rotation, the front of the knee has moved, or the medial side of the knee has moved anterior. So now when I pull forward like this, what am I doing? Anteromedial. So on the ones where I pull forward, it's Slocum's. On the ones I push back, it's Houston's. Okay? Now, McMurray's test. You want to have a way of palpating the joint line of the knee, or what we call the eyes of the knee. Or what do you guys call it in the Chinese medicine? Okay, so depending on the size of your hand and the size of your patient, I'm going to put my thumb on this side and my fingers on the other side. So what I'm going to be doing here is either internal or external rotation in either valgus or varus. And there's a little bit of something, it's not exactly right in the notes, so just make sure that you write it down. I mean, the way these notes used to be is that it would just say, here's the test, and you had to write it all in. So, because you have to learn supposedly when you write it. But basically, what you want to understand is the same concept. When I externally rotate like that, which side of the knee is moving forward? Medial. So which meniscus am I checking? Medial meniscus. And then to add to that, I'm going to do valgus. So I'm holding in this position. So this part of my hand is forcing it into valgus. This part, the other hand is externally rotating it. And then I'm feeling here. So I'm going like that. Okay. Now the other side, I'm feeling the joint line here. I'm using this to do varus, and I'm going like that. So you can either grasp it along here like this, or you can grasp it here like this. Okay? So I'm going this way, I'm going that way. Okay? It's something you just have to practice, as long as you understand that it's the same kind of concept we were talking about here. This is moving the front medial side of the knee anterior. So now I'm doing medial meniscus. And I'm pushing this way, and pushing that way to do the valgus. The other way, another way you can do it is this way, reaching underneath and feeling here. Or you can do it this way, and pushing here. Okay? So then here, the bounce home test. I'll do it on this side. So basically you're just doing that. And you see hers locks out if you're looking for it to pop up like that. So that's either going to be swelling or it's going to be a loose body in the knee. And then as far as swelling, one of the things that's a specific type of swelling when you have it in the joint like this is called effusion, where there's swelling inside of the joint capsule. And what you can do is you put your hands on the side like this. If I push here, and it pops out over there, then you know the swelling's going through the knee like this. Okay, so same thing if I go here. And sometimes what you have to do maybe is you might have to, if there's a little bit of swelling, you sort of have to milk it a little bit to bring the swelling out. And then you can push this way and you feel it over there. So what that's doing is you're trying to identify if the swelling is outside of the capsule or if it's inside the capsule. If it's inside, you push here, it'll pop out over there. And then Clark's sign, remember that one, right? You're pushing down on the kneecap like this, contract up here. Medial patellar plica is that flap of tissue that's on the medial side of the knee. I'm pushing this here and palpating there. Okay? And then what am I doing if I'm pushing the kneecap the other way? Like this. Which way does the patellar dislocate?
Your body's apprehension.
Yeah, wasn't that your...
Yeah, I was like...
The light should have went on there. Okay, so you can do it in flexion, in extension. You can do it in a little bit of flexion. Once you get into here, the kneecap's not going to move. It's locked in the groove. And then, we talked about this before a little bit. Okay, what's this here? What test is this? So I'm palpating at the femoral epicondyle, lateral femoral epicondyle, and then going like this. So what snaps across here? Okay. And then tests that you can do either supine or seated. So let's try some seated. Come forward like this. Okay. Now the valgus and varus. All right. Which one is this? Varus, right. So you do it at full extension. You can do it at a little bit of flexion here. Then, depending on the situation, if you feel comfortable doing it like this, you can sort of lock this out like this, and it gives you ways to check the knee like that. Okay. And the other one I didn't show before, the ligament. What's this one? What's that? Latchman. It's another for anterior cruciate. Okay. And you remember we saw the video before where. Okay, then